Okay, so these are myofascial techniques for Erector Spinae. Remember, myofascial, you do it without lotion. It'll be slow, whole hand techniques. And as we saw in the video, there'll be a couple different things that you can do in terms of myofascial. One other thing I want to say, work in the direction of ease. Do you remember that? So we'll determine which way the fascia feels easier to move. And in terms of up and down, I feel like her fascia moves easier this way, so I'm going to go with it. So the first one that you can do is just a whole hand glide. Notice my fingers and palms, thumbs, everything's in contact with the client. And it's like I'm trying to drag that top layer in the direction of ease. And so you can carry that out 60, 90 seconds. Another example of a myofascial technique would be skin rolling, right? And this one, you're riding the wave. Not getting muscle, just getting some superficial fascia. My thumbs are kind of pushing and my fingers are feeding it. And because fascia goes in all directions, so can your myofascial release. So we did the full hand glide, skin rolling. You can do a cross hand glide. Your level of pressure is like a 2. So for time's sake, I'll cut that short. The other one that I want to remind you of is the muscle rolling. Remember that? So as we saw in the video, this is different than skin rolling, right? Skin, you're just kind of getting that top layer. Muscle rolling, your intention is to roll the deeper fascial layers that go around every little muscle fiber. So you're kind of picking up the muscle and then rolling it out. If I were skin rolling this area, might look like that. Muscle rolling, I've got more of the muscle belly. And you'll really find a wide variety of looseness in people's fascia, especially in the back. So I'm going to have you guys try those myofascial techniques. So next on our list of techniques for Erector Spinae is using the pressure ball or P-ball. And we are going to actually do cross fiber friction using the P-ball just on the side of the spinous processes. So if these are the spinous processes, I'm going to go at a 45-degree angle on the same side as I'm standing, sink onto the side of the spinous process, and go back and forth. And I'm going to do it today we'll do it the entire length of the Erector Spinae. Think about doing cross fiber at a muscle attachment. That's all it is. Would you do the entire length of Erector Spinae during a normal session? Probably not. You'd probably target an area that you felt was tight or felt was problematic. But today I want you to do the entire thing. So that means we start way down by the sacrum. And now here, your pressure is, whereas with myofascial release, it was like a 2, now your pressure is going to be a 3 or 4, depending on client comfort. So Ellery, you let me know if something's uncomfortable or if it's just a little too much. Okay. So here I'm holding the pressure ball like a pencil between my thumb and first finger. Could also do it in between fingers. And if you feel like you hit an area where it needs a little more work, spend a couple more seconds there. It is as much treatment as it is palpation. You're feeling as you go and also treating. Trying to hit, ideally, every spinous process. Okay, so let's try P-ball work on spinous processes. All right, and then our last technique for the Erector Spinae, you'll find that this will be the technique for most of the muscles that we do trigger point work on. We just did cross fiber on the attachments, and now we'll do deep stripping or deep gliding on the belly of the muscle. And you'll be standing both at the hips of your client and then later at the shoulders, searching for trigger points both directions. So it's different from a glide because your intention is different. A glide, right? I'm doing a glide right now. Nice spreading lotion. My intent is to calm their nervous system and feel good. So when I'm doing the trigger point search, you can use thumbs, you can use fingers, supported fingers, piggyback, whatever's most comfortable. But your intention is searching for a trigger point, right? It'll feel good while you're doing it. That's wonderful. But you're actually searching for a trigger point. And remember, we've got really 3 muscles that we're working with. What's the farthest one lateral? Starts with an I. Yes, iliocostalis, that goes laterally up under the shoulder blade. What's the middle one? Longissimus. That's the one that, if you go back and forth, it's the most prominent one. And then the one closest to the spine? Spinalis. So that means that your searches will be close to the spine and then a couple more paths out, maybe 3 inches or so. So I'm going to start close to the spine. And I'm sinking in, level of 3 or 4. And notice the pace of my stroke. This helps not only you take in the sensory input, but it helps give them time to become aware if something's tender. So I'm going to tell my client, let me know if anything is especially tender, okay? So I'm relying on feedback from my client and also feedback from my fingers. Before I get too far, I'm going to come out laterally. I'm a little tender here. So trigger point therapy says that I'm going to hold this. I could even invite my client to take a deep breath in and then slowly exhale. You could wait 30 seconds. You can check in with them, ask them if the pain has lessened at all, and then keep going. Be sure that as you move up the body, your front knee is flexing instead of bending at the hips. So then you'll do a final pass laterally, and then the same thing getting the upper half. So right here, I feel something that feels different than the surrounding tissue, but when I pay attention more closely, the fibers are going this way. So is that probably the Erector Spinae? No, it's probably like lower traps. The Erector Spinae will go more up and down. So for now, I'm gonna ignore that. All right, so upper body, couple passes out, and then I want you to finish with a palm roll using the heel of your hand, working same side as you're standing. Go back and forth. So it's kind of a broad cross fiber. Okay, well, let's try. Oh, wait, no, not okay. We still going? Awesome. The last thing I want you to do, remember the Erector Spinae actually goes onto the iliac crest. So when you're standing at the shoulders, you get all the way here. Be sure to go all the way to the iliac crest. So from the midline, go about halfway out and search there also, because these lower Erector Spinae fibers connect to the iliac crest. Okay, now for reals, we're out.